We all want access to good health care, whether it's preventative measures such as immunization, the management of ongoing conditions, or critical illness and emergency treatment. Everyone wants the reassurance that their mental and physical well-being is in safe hands. My name is Alex, and in the video today, we take a look at the Caribbean countries with the best health care. Welcome back to Elite Jamaica, the place you come to learn about Jamaica and Jamaicans. If it's your first time joining me here, consider subscribing to the channel by clicking that red subscribe button. And remember to turn on notifications by clicking the bell icon so you never miss any of my updates. Dominican Republic. Foreign nationals treated in a private medical facility in the Dominican Republic will find the level of treatment and care available similar to those in developed countries. Standards in other hospitals will vary. In an emergency, the ambulance service is, at best, hit and miss, and treatment may need to be paid for upfront. Expats might want to take out comprehensive healthcare insurance and to check whether it covers repatriation or evacuation for some conditions. Contact your health insurance provider as soon as possible if you need treatments, and watch out for overcharging. From a global outlook, the Dominican Republic's healthcare system is ranked at 51st in the world for performance, just behind countries like Malaysia and Thailand, and there are 1.5 doctors per 1,000 inhabitants, roughly the same as Colombia. Jamaica. The standards in both private and public medical facilities can vary, and some may not be up to the expectations of foreign nationals. That said, the best hospitals are around the tourist areas like Montego Bay and the capital, Kingston, and cater adequately for most ailments. The country is home to the University Hospital of the West Indies, 24 public hospitals, and 10 private facilities, while primary health care is delivered through a network of clinics and regional centers. According to World Health Organization data, the country is 53rd in the world for the effectiveness of its healthcare system, but only has one doctor per 2,000 population, which is quite low on the world scale, comparable with countries like Nigeria and Fiji. Looking to the future, this developing country has its sights set on improving life for its citizens, spending 5.4% of its GDP on healthcare. Expats might want to consider a comprehensive level of healthcare insurance and access to cash to pay for treatment if and when upfront is required, and possibly enough to cover evacuation or repatriation if necessary. Cuba. With a thriving medical tourism industry, the country has excellent facilities for private patients. The best care is available in the capital city of Havana, while standards in more rural areas vary. Comprehensive insurance can be invaluable. It may be worthwhile ensuring you have enough cash to cover treatment or evacuation, as payment may be required upfront. Many medicines aren't freely available, so you may need to bring them up from home, along with a prescription and a letter from your doctor outlining why you need them. The government claims to provide a comprehensive healthcare system for citizens, but the standard of facilities and availability can be inconsistent. The performance of Cuba's provision places the country at number 39 on the World Health Organization's league table. There are nearly 7 doctors per 1,000 population, one of the highest ratios in the world, which is a reflection of the high percentage of the country's GDP spent on healthcare, that's 11.1%. The Bahamas. Set across a range of islands north of Cuba, the Bahamas is a major tourist hub for Westerners and home to many expats looking to retire in the sun. As a result, it has an excellent standard of medical provision, to the level many foreigners would recognize from home. Everyone has access to the facilities found in the 3 main public hospitals, 2 in the capital Nassau and another in Freeport, offering a range of care from maternity to surgery. There are also 2 private hospitals on the other islands. Medical provision may not be available 7 days a week across a network of clinics, although emergency response teams staffed by volunteers are in operation. Do your research first and make sure you can cover the cost of being airlifted to a major hospital in case of an emergency. It's worth nothing there. is no public health scheme foreign nationals can contribute to. Health insurance is available to cover emergency treatment. Even if you have insurance, you might want to have enough cash with you when you travel, as the hospital may require payment upfront. You might also want to ensure your policy covers evacuation or repatriation. While medical provision is quite comprehensive, certain conditions may require treatment elsewhere, such as in the US. The country spends a healthy 7% of its GDP on health. There are nearly 3 doctors per 1,000 inhabitants, putting the country in line with places like the UK and Finland, and the healthcare system is ranked at 94 in the world by World Health Organization. Across the rest of the Caribbean, with different cultures, governments, political histories, and populations, the standards of medical facilities can vary from island to island. The area is home to many expats. Good quality healthcare is available, even if you have to travel to get it. Foreign nationals in the country might want to ensure they have a comprehensive level of health insurance and access to adequate funds to pay for the repatriation or evacuation for treatment if necessary. For anyone considering to move to another country to live and work, it's sensible to do some detailed research on your healthcare system. You'll need to find out where are the best hospitals, what access do foreign nationals have to universal healthcare, what standard of facilities and personnel are available. And what about insurance? In most cases, this will be compulsory, but in order to ensure your health and safety, what level of cover will you need? Consider whether you might need access to a general practitioner, inpatient and outpatient care, specialist treatment for ongoing care and emergency healthcare provision, evacuation or repatriation if the treatment you need isn't available locally. Thank you for joining me again, guys. I really do hope you enjoyed this video. If so, please consider subscribing to Elite Jamaica by clicking the red subscribe button, and remember to turn on notifications by clicking the bell icon. I am Alex. Bless.